Since 2014, Birmingham Changing Futures Together, along with our partners Shelter, St Basil's, Birmingham Mind and Cypher Fireside, have worked to improve support for those facing multiple disadvantage. We define multiple disadvantage as people experiencing two or more of the following issues: homelessness, problematic substance use, risk of offending, and mental ill health. Over 8 years, we have engaged with 1,823 people facing multiple disadvantage, trained over 200 members of staff, had nearly 200 people with lived experience employed in either voluntary or paid roles within the project, and the lead worker peer mentor service alone made cost savings of over £3 million. Each person facing multiple disadvantage is an individual with their own story and their own needs. Without the right help, people can become trapped in a never-ending cycle. Dave has lived on the street for 18 years, struggling with drug dependency, mental health issues, and has struggled to engage with mainstream support. Birmingham Changing Futures Together has developed approaches to better support individuals like Dave whilst they face multiple disadvantage. We have developed strong working partnerships. These partnerships led to many organisations gaining a better understanding of the situations those facing multiple disadvantage encounter and how to work together to best support individuals. The No Wrong Door approach showcased the benefits of organisations communicating closely, discussing barriers and sharing good practice to improve the support they provide when working in partnership. By growing and encouraging partnership working and embedding staff within partnership organisations, we have been able to share good practice with such wider partners as Housing First, the Rough Sleeper Initiative, and Birmingham City Council's Exempt Accommodation Quality Standards, as well as supporting organisations to integrate the lead worker model and adopt a psychologically informed environment. We have also trained and upskilled staff in charities and organisations to help them see the full picture and guide them on how to offer the right support to those in need. This has improved the experience for those seeking help and support, which positively impacts engagement. Further communication and collaboration between organisations has been achieved. We developed a computer system which helped different organisations collaborate by sharing real-time information about individuals, helping everyone be on the same page and ensuring stories are not retold and trauma relived. This showed that there is a need for the continuation of data sharing and linked case management in order to help both staff and clients achieve the outcome they desire. We also provided the Bridging Fund to help people as they progressed on their journey. The Bridging Fund was utilised to provide additional support to those in need. Over a third of this fund went towards helping people transform unfurnished houses into homes, leading to more sustained tenancies, less abandonment, and a foundation on which to build recovery. We've placed value on lived experience. We've given those with lived experience both paid and volunteer roles that allow them to connect with and help other people who are at the start of their journey. Having the roles of peer mentors, befrienders, experts by experience, and outreach workers helps build trust and supports an individual's engagement with services. We've also supported co-production, allowing the voices of those with lived experience to influence and shape policy. In collaboration with a group of volunteers at the very start of the programme, they created the role and title of Expert by Experience, a group of volunteers that would help, support and influence change at a systematic level. Our Experts by Experience have recently collaborated with Ernst Young, Birmingham City Council and Citizens Advice Birmingham to help them work more effectively with their clients that face multiple disadvantage. The Experts by Experience have gone on to work nationally as part of the National Expert Citizen Group, being involved in such parliamentary activity as Dame Carol Black's independent review of drugs. But now it's time for organisations and commissioners to pick up the baton. Birmingham Changing Futures Together may be coming to an end, but people will continue to face multiple disadvantage. By implementing and continuing our programme learnings, those facing multiple disadvantage can receive even better support and have a voice in change.